Okay, I'm going to do the expansion because I forgot to palpate for that. Okay, can you breathe for me? So it's symmetrical. So it's at the T9 to T10 of the posterior chest. Oh, and also I'm going to check percuss for your kidney, your CVA, if it's tender. Is it painful?
No.
Okay, so it's negative CVA tenderness. Okay, Mr. Sia, can you face here? Okay, I'm going to remove this one. Okay, can you relax? Relax. Okay. So looking at the chest, I can see that the chest is not barrel chest, and because the anteroposterior diameter is less than the transverse diameter, and the color, they are normal color, and they look symmetrical. And looking at the respiration right now, it's not fast breathing, it's unlabored breathing. And also the depth is normal depth. And then looking at the chest, so I'm going to palpate now. So it's symmetrical expansion. Okay, and then also after palpation, I'm going to check also for masses and tenderness. So is it painful?
No.
Okay. Since I'm already palpating, I'm also going to palpate for any breast masses. I did not feel any masses, and there's no discharges in the nipple. And looking again, inspection, I did not see any retraction or dimpling. So I'm also going to palpate for any nodes in the axilla area, and I did not feel any nodes. Okay, I would go back to the neck because I forgot to palpate for the lymph nodes here earlier. The posterior auricular, submandibular, and preauricular, anterior cervical. I did not feel any nodes, and also the posterior cervical. I did not feel any nodes. And also I have to let him move the neck also because I forgot to check for the range of motion of the neck. So can you please put your chin in front and also the back, and can you please put your ears on your shoulder and also the other side. Okay, so the neck is supple with the range of motion. Can you also move your arms going up? Same with the other one. And down. So also at the side. So also the arms has a good range of motion too. Can you move your hands? Okay, so it's a good range of motion also. So I'm going to check still on palpation of the chest. Going to check, can you say it? 99.
99. 99. 99.
So it's equal fremiti, and I did not feel any crackling feeling for the prepitus. Okay, now I'm going to auscultate. Before auscultation, I have to do first the percussion. Okay, so the sound of the lungs, it's resonant. And when you feel dullness, it's because of the solid organ, and if it's flat, it's bones or muscle. But his chest, they're both equal, and percussion are resonant. Okay. Then I'm going to auscultate again, starting from the apex of the lungs. Inhale, exhale. So it's clear breath sounds, no crackles, bronchi, no ralls. Normal. Now I'm going to check the heart. So I will let you lie down for me, and this one I'll drape you. Okay. So inspection of the chest. I did not see any pulsation. The skin color normal, and now I'm going to palpate. I'm palpating for the apical pulse. The apical pulse, using the ball of my fingertips. I can feel it's here, so it's 2, 3, 4, 5. So it's in the fifth left intercostal space, mid-clavicular line. And let me feel for any trills. Trills is the palpatory murmur, and it's negative for trills. And also negative for Hib. After palpation, I don't have to do percussion. I just have to proceed right away to auscultation. First, I'm going to listen in here the aortic valve, the pulmonic valve, the Erb's point, the tricuspid valve, and the mitral valve. And then supposed to be, if it's normal, I will listen to both aortic and the pulmonic. The second heart sound in here is louder. And then for the tricuspid and mitral, the second heart sound would be louder. And normally there should be no murmur. So I will use the diaphragm of my stethoscope to listen to that, and then I will change it into bell, and I will listen for S3, S4 also. Okay, and if I cannot hear it, I would let him lie on the left side so that I can hear it better. Okay. So there's no murmur. Now I'm going to check for S3, S4. Can you lie on that side for me? Okay, so I did not appreciate any S3 or S4. Okay, so it's normal. So then I will check the abdomen. First, I'm going to do the inspection, and since it's an abdomen, I will start off after inspection with auscultation. After auscultation, I will do the percussion and then the palpation. So inspection, its abdomen is a little bit protuberant, and I did not see any pulsation or peristaltic wave. Now I'm going to proceed with my auscultation. First, I will use the diaphragm of my stethoscope to listen to the bowel sounds. The normal bowel sounds is 5 to 34 gurgles per minute. And after that, I will change it into bell and listen to the pulsation if there's any bruit. First in the aortic area, and then the kidney, renal arteries, and then the iliac arteries and the femoral arteries. So when I listen to the bowel signs, I'll have to cover the 4 quadrant of the abdomen. First, so I'm gonna listen for the vowel sounds first. So it's not normal. So I'm now going to use a bell and I'm going to listen for any bruit. This is the aorta, the renal artery, the iliac artery, and the femoral artery. So it's negative. Then after that, I will start with my percussion. So I will percuss it as like that. Okay, and the normal sound for the abdomen is the tympani. So it's normal. It sounds like a drum. If there's fluid in it, you will appreciate that it's dull. It's not tympanitic. And now I will proceed with my palpation. I will check for the tenderness. If it's tense, I will start with all the four. I will start with the 4 quadrants. Can you bend your legs for me too? Okay, so it's soft. It's not tense. And do you feel any pain?
No.
No tenderness? Okay, so I will now feel the palpation for the liver. Using both hands, I cannot feel any liver. It's non-palpable. Now I'm going to check for the spleen. So using both hands again, I cannot feel any spleen. So there's no organomegaly. So after that, I'm done with the abdomen. Okay, so I will also check the femoral pulse. It's normal. And I'm going to feel for any femoral lymphadenopathy, and it's not palpable. Okay, so can you sit and I will check for the legs now. You can put this back. Sorry. Alright. So looking at both legs, their normal length, normal size. So I will looking at the legs, it's the length, they're both normal. They look symmetrical to me. The color normal. There's no lesions, but there's some varicosities in here. And I will now start to palpate. There's no edema. The temperature, they are normal. If they're cold, they're more of arterial problem. If they're warm, they're more of venous problem. I'm going to check for the nails. So capri fill. So it's normal. It's within 2 to 3 seconds. Looking at the texture of the nails, there's no discoloration. And also what else? The pulse. Checking at the pulse, it's equal popliteal pulse. And also let me see the dorsalis pedis. They're both normal also. And the posterior tibialis. Okay, they're also normal.